Hello, my name is Mohamed, and today I'll be discussing alternative medicine and some of the truths and misconceptions taken by people. First, we need to know what alternative medicine is. So, alternative medicine is a term that describes medical treatments that are used instead of traditional or mainstream therapies. Some people also refer to it as integrative or complementary medicine. They also come from a lot of different cultures. Alternative medicine practices are used for both physical and mental ailments. Some alternative practices are based on theories that contradict science of how the human body works. Others resort to the supernatural and superstitious ways to explain their effects. Many complementary therapies concentrate on relaxation and reducing stress. They might help to calm your emotions, relieve anxiety, and increase your general sense of health and well-being. Many doctors, cancer nurses, and researchers are interested in the idea that positive emotion can improve your health. Let's take an example of alternative therapy. For example, the using of a special diet to treat cancer instead of undergoing surgery, radiation, chemotherapy that has been recommended by a physician. Alternative medicine types are difficult to define largely because the field is so diverse. But here are some of the more important types in my opinion. First, a very popular type of alternative medicine is acupuncture. This is a traditional Chinese medicine technique that uses needles to stimulate specific points around the body. The person who performs this therapy sticks a thin sterile needle into your skin. The goal is to help your body's natural healing process kick in. Studies show that acupuncture can be effective in treating a number of conditions like neck and back pain, nausea, anxiety, depression, insomnia, infertility, and more. Another really popular type of alternative medicine is herbal medicine. This alternative therapy uses parts of a plant's roots, leaves, berries, or flowers to heal the body. According to the World Health Organization, an estimate of 80% of people around the world use herbal medicine. Studies show certain herbs are effective in treating a number of health issues, like allergies, chronic fatigue, and more. Unfortunately, herbal supplements can be sold without being approved to be safe or effective. Talk to a doctor if you're thinking about using them. Another really popular type is chiropractic medicine. This practice focuses on the body's structure, mainly the spine and how it functions. A trained professional called a chiropractor uses different techniques to adjust or manipulate your spine or other parts of your body so that they are in proper form or aligned. The goal of chiropractic medicine is to ease pain, improve body function, and help your body to heal itself naturally. Much of the research around it has focused on lower back pain, but studies show that chiropractic medicine can also be helpful in a number of other ailments, like headaches, neck pain, joint problems in your upper and lower body, and disorders caused by whiplash. Now that we have taken a quick peek on the description of alternative medicine and some of its types, let's take a quick look at some of the misconceptions and truths that have been proven by some studies. Now, let's take a look at one of our first misconceptions, is that alternative medicine is only an alternative. In fact, many alternative practitioners are also medical doctors, chiropractors, or other trained medical professionals. Others work closely with MDs to coordinate care. Patients should always let all of their healthcare providers know about all treatments that they have received from all others. So our second misconception is that natural doctors do not use conventional medicine. Well, no credible natural doctor will ever tell a patient to replace their prescribed medication without consulting with his or her original doctor. In many cases, the MD and natural practitioner are the same person. If not, they will coordinate treatment to benefit the health of the patient. So our third and really big misconception is that alternative medicine does not work. Well, actually, licensed health providers won't just suggest natural therapies in an instant. They will consider scientific studies and their own experience to suggest therapies that do work for the patient's ailments. Countless studies have, for example, confirmed that acupuncture is an effective treatment for many medical conditions. Also, the right dietary changes are known to help improve health and even minimize or cure some diseases. Numerous other alternative therapies have been proven effective by scientific studies. So our fourth and last misconception, and the most controversial, is that big medical institutions are against alternative medication. Well, according to a recent survey, about half of big insurers pay for tested alternative therapies like acupuncture. Also, hospitals and doctors do recognize that lifestyle changes, some herbal remedies, and other kinds of alternative medication may reduce side effects, allow patients to reduce prescription medicine, and even lower medical bills. So, here are some truths about alternative medication. Some complementary methods have been studied and shown to help people feel better while they are undergoing standard illness treatment under a doctor's care. Examples might include meditation to reduce stress, peppermint or ginger tea for nausea, and guided imagery to help relieve stress and pain during medical procedures. So firstly, we have that acupuncture may help with mild pain and some types of nausea. Secondly, we have art or music therapy may promote healing and enhance the quality of life. Third, we have biofeedback, which uses monitoring devices to help people gain conscious control over physical processes that are usually controlled automatically, such as heart rate, blood pressure, temperature, sweating, and muscle tension. So fourth, we have massage therapy that can decrease stress, anxiety, depression, and pain, and increase alertness, according to some studies. So fifth, prayers and spirituality, which help many people with the emotional side effects from illnesses. Lastly, we have Tai Chi and yoga, which have been shown to improve strength and balance in people. So finally, in my opinion, the best medicine combines conventional and alternative medicine. Everyone needs to find the right healthcare providers to enjoy the safest and most natural care possible. Good natural health providers will have a solid education in their field. Nobody should just abandon their medical treatment to pursue alternative cures. However, seeking alternative therapies may help improve many people reduce their reliance on harsh medication by following the advice of alternative providers and coordinating their care with all their healthcare providers. Thank you so much for watching. I hope you enjoyed the video.